So the physiology of the heart was what fascinated me throughout medical school and led me down the path of heading towards becoming a cardiothoracic surgeon. And then once I actually started scrubbing in on operations of the heart, it's just a fascinating organ. And then whenever I scrubbed into cases, into heart cases, watching the heartbeat, watching it, understanding the physiology and how we manipulate the physiology to do the steps and to do the interventions we need in the operating room fascinated me and really drove my passion for the work I do now. My specific passion is in advanced heart failure therapies. That includes heart transplantation, ventricular assist devices, but also short-term support such as ECMO and temporary devices. I would say the minority of patients come in with a sudden event. When that sudden event happens, the heart doesn't have a chance, doesn't have time to adapt. And so we have to buy that time for the patient with a temporary device at the very least. Whether that be ECMO or a temporary LVAD or something like that, we get involved to place them on that type of support to buy their body time to help their body recover somewhat so that we can talk about next steps. As a surgeon providing advanced heart failure therapies, conversations with families are a routine thing, are a very important aspect to the position, to the role. These conversations are typically difficult. It really requires sitting down with them, going over the situation that they had been facing, taking them through what life will be like after whatever intervention we're discussing. Life after transplant, life after having a ventricular assist device implanted. These aren't your everyday lives. Yeah, the most rewarding part of my job, I would definitely say, is taking on a case, taking on a patient who is at death's doorstep and being able to pull them back and support them, get them to a point where they can get home and be back with their family and live good quality years that they otherwise wouldn't have been able to. That 10, 15, 20 years we wouldn't have been able to provide them.